Will you email it then?
Yeah, I'm trying to find it. Forgot who sent it over to me.
Okay.
Yeah. Well, who did the meeting minutes again? I forget her name. Apologize. Might be easier to find out by her name.
I think it was
It might.
Thomas did the minutes, I believe. Thomas?
No, that was the first meeting.
Was it Aaron Furtado?
That's it. Yeah, that's who it was. Yeah, Aaron.
Aaron, okay, okay. You're absolutely right. I don't see her here right now.
Yeah, but I thought she sent me the minute that she wrote. So I'm just trying to find it.
I got an email this morning, or yesterday maybe, from the commission with the agenda for today and the meeting minutes from July 9th. It doesn't say here who it's sent from, but I can check on my phone.
Oh, okay. I apologize. I'm doing a little bit more prepared, but I just rolled off a work meeting like 5 minutes ago. Okay.
It came from Pamela Zellner.
Hi.
Oh, okay. There we go. Yeah, so Pam sent it out yesterday afternoon. So do you want me to forward it to you, Ernest?
Hi, this is Carmen.
Hi, Carmen, go ahead.
I just forward them as well to Brett and Ernest, the email that I have received from Pamela.
Oh, thank you.
You're welcome.
Thank you, Carmen. I really appreciate that.
Okay, Carmen, it looks like Ernest is looking for it. He's just looking on his screen right now to see if he got it. It's taking a while.
Did you guys hear a beep through my sound? I'm just making sure.
No,
Okay, thank you. I didn't know if it was my computer projecting it on everybody.
Ernest says, I'm sorry for my silence. I apologize. Can't hear a thing.
I'm happy to share my screen and show the minute. Well, when we get to that point, if we like.
Yes, that would be great.
Okay.
Thank you. Yeah,
Right.
it seems Ernest is saying his computer is, he just got the agenda.
I'm gonna share the meeting agenda right now. I'll go back and share screen. So it said the host disabled participant screen sharing. Okay.
We can see it, Brett.
Okay. All right. Great. All right. And if I can zoom in a little bit better. You see that better?
Mhm.
Okay. All right. Well, first of all, thank you everyone for coming to the second meeting for the healthcare committee. Since I've joined as a chairperson, I know you guys have had meeting prior to me joining, but like we always do, like to start off with brief introduction with everybody. Myself, I'm Brett Hayes. I'm a commissioner for the board and also the chairperson for the healthcare committee. And do we want to take turn and introduce ourselves? See who's here today?
Brett, this is the interpreter. I can't see everyone because of the agenda.
Okay. I'll stop my screen.
Okay.
Then a bit of a challenge trying to stop it.
Sorry.
No, it said disabled participant screen sharing. View option. Edit full screen.
I think Ernest is sharing.
Ernest should be sharing.
Oh, Ernest is the one that's sharing. That's who it was. Oh yeah, because it's named on the top right of the Word document. So Ernest, do you mind if you can stop sharing for 1 minute?
Ah, beautiful. Thank you.
Thank you.
I can see
Now we
everyone.
can see everybody's faces. All right. All right. Yeah. So why don't we just introduce ourselves to you here today, and we'll start with you, Ernest.
Hi there, everyone. My name is Ernest Covington, Executive Director of the Commission on the Deaf and Hard of Hearing. Very nice to see you again.
Thank you. Christine.
Hi, everyone. Christine West, Project Manager for the Rhode Island Commission on the Deaf and Hard of Hearing Healthcare System Transformation Project. Nice to see everyone today.
Thanks for joining us. Caroline.
Hi, I'm Caroline Elbrecht. I'm a chairperson on the, not chairperson, I'm a commissioner on the Rhode Island Commission for the Deaf and Hard of Hearing.
Thank you. Carmen.
Yeah, I was mute, sorry.
That's okay.
Good afternoon. My name is Carmen Boucher. I work for the Rhode Island Department of Health at the Health Equity Institute. And one of my many titles there is Community Program Liaison.
Great. Thanks for joining, Carmen.
Thank you.
And then we have Alexander.
Hey everyone, I'm Alex. I am serving as the outreach coordinator for Hstp with Christine.
Great. Thanks for joining.
Thanks
and
for having me.
then after that, we have Michelle.
Hi, good afternoon. I am Michelle Zylan from the Office of Healthy Aging. I'm the Associate Director.
Oh, welcome. I know I've reached out to you in the last month, and I didn't realize you're already on the emails, but I look forward to having you with us.
Thank you.
Thank
I'm
you.
happy to be here.
Thank you. And then we have Tammy, who is the cut reporter, and we have Carol Fay, the interpreter. I think she's the only one we have here for now. So I don't see anybody else. But again, Carol, if
I believe
you need,
it's Simon. We're just waiting for Simon. I
okay,
don't mind if you want to go ahead. I'm sure
Okay.
Simon will join us.
all right. And if not, if you need a break, please let me know, and we'll give you 5, 10 minutes, 15, however you need.
Thank you, Brett.
All right, of course. All right. And then, Ernest, you mind sharing the screen again, please?
Oh, did you mean share the screen with the agenda?
Oh, yes, yes. Thank you.
Oh, there we go.
Great. All right, thank you. Just a quick rundown of the agenda, and then we'll get to point 2. So we did a brief introduction, and then we're going to appoint a secretary for today's meeting. And then we'll review the July 9th meeting minutes draft that Carmen was nice enough to share with us for the meeting. And then I added in the Open Meetings Act with June meeting executive order in case anybody wanted to review it and have questions. I know Alexander previously had asked about potentially recording meeting. And then the meat of the meeting will be about progress update for the healthcare community and the Hstp projects. We'll talk about the spotlight series and networking that we would like to have it go with. I will talk more about surveys if there's an update. And then I believe earlier this week, we had a directed community discussion with interpreters if there's anything we want to discuss in our forum about that meeting, now would be the time. And then I'll open the room up to public comment. And then we'll schedule a future meeting. And then we'll wrap up the meeting. All right, and then back to bullet point 2. If anyone who would love to volunteer, it's everyone's favorite job, to be the secretary to record the meeting minute. And I will say that we will be able to get the transcript of this meeting after the meeting and share in order to complete the meeting minute. So, any volunteers? And might need Ernest to pull down the share the screen in order to see other.
I actually have a question,
Yeah, sure.
and maybe this pertains to another agenda item later with the revised Zoom. Oh God, what does it say on the agenda? The
OMA.
revised executive order regarding OMA with Zoom meetings. If we're recording the meetings, are meeting minutes still required? So that's one of my questions. And so I think before, maybe we should just jump to that agenda item first before we identify somebody to take minutes, because it's possible we don't need it. I'm not sure. I was wondering if we could get a little bit more guidance on what that executive order says. I admit I haven't read it myself, but I'm curious to know what the ins and outs of it, to know whether meeting minutes are even required.
I'm emailing that to you now. This is Ernest speaking.
Okay.
That's a very good question. And I actually opened up the email that Ernest shared with the commission back in July, which had the full language of the executive order. And I'm happy to share that if I'm allowed to share, or should I forward it back to Ernest? Should I?
Okay, Ernest is
Yeah.
gonna open that up.
Yeah, you sent it out on July 28th, 3:10 p.m. So you might have it in your sent folder. July 28th.
Sorry, Ernest isn't, July 28th. Ernest isn't looking right now, so he didn't catch that yet. Oh, there we go.
Oh, great. Does anybody need a nap? Could now's a good time reading a government document. Well, the basic summary I'm looking at from the email is that the revised provision is required that all CDHH Zoom meetings must be recorded all the times, starting effectively today, July 28th. Please review these policies about recording the Zoom meeting below. The first one is recording meetings. The host must ensure meetings are being recorded, both open and executive session. If functionality is available and enabled for saving.
Brett, I'm sorry, can you show us where that says it in the document? Can we get to the place in the document where you're reading that?
Oh, yeah, sure.
Thanks. Do you know which page it is, Brett?
Well, the one that Ernest sent was, I think, a summary, or he pulled the bullet point from that document. So I don't know exactly what page it's in. So that's why maybe I can just forward it to him and then he can just quickly bring it up.
Okay, great.
Yeah. So Ernest, another way is if you do a Control F and you search for a minute, it might bring you to a point that talks about meeting minutes.
Brett, the interpreter can't see Ernest, so I don't know if he
Oh.
can see the interpreter. I'm not sure. Maybe he
Oh,
can't.
okay,
Sorry.
that's a fair point. Maybe I'll send a chat to him.
See, it's down further, you saying?
Yeah, I sent him a note. Yep, that's it.
Okay. Ernest is saying there's 3 more. 304? 3 or 4? Okay. Whether one of our super meetings should be recorded and those recorded should be made.
I mean, you raised a good point, Christine, that it's possible it's not in the language about meeting minutes.
Okay. All right. Is there any way that we can get clarification from legal just to kind of get an idea about are meeting minutes required if the meetings are also recorded? Because I think that'll save us a lot of work from having to identify somebody if the recordings are sufficient and they're going to be made available to the public. My other question is, and again, I'm sorry, I apologize, I haven't read through this, is are these, when they say made publicly available, what do they mean by made publicly available? Do they mean that they're stored electronically at the commission and then they're available upon request? Or are they supposed to be uploaded to the Secretary of State's website, just like the meeting minutes? Or I'm not sure if that is specified. Does it just follow the same thing as the meeting minutes do, where you post it on the Secretary of State's website? Like, for example, for meeting minutes for any of the committee meetings or the board meetings, we don't necessarily post them on social media. But I know that we post them on the Secretary of State's website. So I'm wondering if, where's the appropriate place to make it publicly available is my question. And do we have some guidance on that from the Secretary of State? And I'm not sure if others in the meeting know that answer, but it might be worth looking into. So we know what those appropriate places are, and we know whether or not minutes also have to accompany the recordings or if the recordings are sufficient.
Got it.
So that's fair. It's definitely a fair point. And maybe Ernest, you can ask legal, or we can bring it up in the next commission meeting for clarification on that. Because it does seem like a redundant effort in order to record the meeting and then do the meeting minutes. So, and I do wonder if,
I did contact legal about the recording, and legal said that it does apply to that we do have to do it, but I'll get clarification about the minutes. I know recording is required, but do they need a transcript of the minutes at the same time? I'll definitely look into that and let you know. If there's any other questions or policies, I just gave you the summary. That's what's on the screen right now, or what it is, what's there right this second. Oops.
okay. Are we looking at, I have the same background. I couldn't tell if it was my computer or his.
All right, well, I'll take meetings, minutes, just in case we need to have them done. So I don't mind doing that today.
I really appreciate it, Christine. Thank you.
And Ernest just said that he just put the minutes up, or he's going to put the minutes up.
Okay.
But there's only.
I mean, I can read it off my screen, and then that way we can keep the screen for the interpreter and not have to go back and forth. Okay. All right. Thank you, Ernest, anyway. All right. So
Brett?
then, did somebody have a comment?
Brett, this is
Carmen.
Carmen.
Yeah.
I just wanted for the minutes during the introduction, the attendees, they just have my name and then they have Health Equity Initiative. Can you please put my last name, which is Boucher, B-O-U-C-H-E-R, and then Rhode Island Department of Health? And if you do need to put, it would be Health Equity Institute.
All right. Yeah, I'll write that down.
Thank you.
Of course. Thank you. Okay. Pull up my screen. Okay, and then number 3 is the approval of July 9th meeting minutes. So this one, I probably should ask Ernest to share the screen so that way we can all review it together.
He's putting
And
them.
then after that,
Yeah.
okay. All right.
Sorry, Brett. 1 second, please.
Okay.
There's something missing. Okay. All right, it's here now. We're all set. If you want,
Okay, thank you.
you can scroll down, and that way people can see the whole thing, the whole document.
All right. Thank you. So basically talked about Dr. Marie Lynch's presentation, talking about her work at Rhode Island College and her support to the Hstp projects.
Brett, I just wanted to add a revision. Instead of the SLPI evaluation, I just wanted to change that to ASLPI.
Instead of the SLPI, it's going to be
ASLPI.
ASLPI. Okay. And that is on page 2 or page 1.
Both.
All right. Oh, both. Okay. I'll just do a search on the document for that. Okay. All right. Thank you. And then the next step was when Christine talked about the status of the HSTP project and her work with Gallaudet on the survey. And then the survey for healthcare professionals. And then we talked about outreach to the different networks in the deaf community. Okay. And then the next part is when Alexandra presented about the community outreach program. I think this is the one where we have gift cards for people participating in the testimonials. And then Ernest talked about the diversity meetings we had in July. And then we wrapped it up with scheduling for a future meeting and bringing in more representatives, one from the BDHH and Elderly Office of Aging. And then we ended the meeting. And now, so did anyone move to approve the meeting minutes based on once we make the revisions that have been set forth?
I'll move that we accept the meeting minutes as amended.
Thank you, Caroline. Then forget how it goes. Did anybody have any other questions? I believe it's been a while since we've had.
Need a second? I think you need a
Okay. Anybody second that?
I don't know that we have to be this formal in committee. I think we can.
Yeah, I wouldn't share it. That's why
All right.
I'm being recorded too, so they're watching me.
It's okay.
Okay. All right. Well, thank you. All right, so we'll amend the meeting minute based on what we talked about, and we'll submit it to Pam and Ernest, and then they can submit to under the Open Meetings Act to the state. All right. Thank you. And then I'm going to pull up the agenda, which was number 4. We had talked about the revised executive order for the Open Meetings Act on June meeting. I think that kind of self-explanatory. Ernest talked about it in the beginning with recording this meeting. And then we had the open question from Christine about the idea of recording, substituting for a meeting minute. All
I
right.
I have one point. Believe me, I don't ever want to be a secretary, but I think it might be helpful for just the participating members of the committee to have something to refer back to at the next meeting, because otherwise we'd have to access the full recording or the full transcript. And that
Yeah.
seems to me like that would be a huge task.
Yeah.
Perhaps we could
Yeah.
have, maybe we could have informal meeting notes.
That's a good point. Yeah. Or like yeah, just send a screen in before the next meeting. Uh, very valid point. Definitely to think about. Yeah, and I don't think we offered enough time to share the current meeting minutes. So next time I'll do better to get that available earlier on. The growing pain, bear with me. um, but thank you for that. And then number 5, progress update on the healthcare committee and the Hstp projects. The first bullet point we had was the spotlight series. This is something that Christine shared with me in the last week or so. And was it Ernest that wanted to talk about that, or was that Christine that wanted to talk about it?
The spotlight, I think, Christine, why don't you take it away? Because it's, you just did one yesterday and it went out. So I thought maybe you could talk about it.
Thanks, Ernest, and thank you, Brett. Yes, this week we are rolling out a virtual spotlight series that focuses on deaf and hard of hearing healthcare professionals. And these are a series of interviews that take place via Zoom. They're pre-recorded, and a new interview is released on Wednesday of every week for the months of August and September. And they're really interesting interviews from doctors, nurses, and other healthcare professionals from all over the country. So we have the opportunity to learn about some really innovative models that exist out there. For example, holistic approaches to serving deaf, hard of hearing, and hearing individuals with language concordant providers who themselves are deaf, hard of hearing, or hearing. And so they have, for example, in Michigan, they have a deaf health clinic that serves everyone. And there's accessible communication for everybody, and everybody there, the clinical practitioner, so the doctor, the social worker that is on staff, and also mental health folks, everybody can sign, everybody gets together and is able to approach it from a holistic point of view. So there's some really interesting stuff. This week we spotlighted Dr. Michael Argeny, who is an MD, MPH, MSW, and he talks a lot about LGBTQ health in deaf and hard of hearing individuals, and HIV, STI prevention. So his interview is very interesting. He talks about his own personal journey and some of the barriers that he's encountered through trying to achieve his goal of becoming a doctor. And also the benefits of having deaf and hard of hearing healthcare professionals in the field, and future advice for those students who may be interested in going to medical school who are deaf and hard of hearing, and the benefits of having these individuals within these programs amongst medical schools. So a really interesting interview, interesting talk. I hope you'll watch it. It's posted on Facebook and Twitter, and a new one will be released every week for the months of August and September. So we're hoping that it will be well viewed and it will be shared widely. And so if you can send it out to your networks, we certainly look forward to that, and we welcome any of your feedback. And we hope that it'll start generating some conversation out there about possibilities for future ideas in Rhode Island on how we can work with this community who has these very unique needs, and by community meaning deaf and hard of hearing both. and how we can provide more holistic approaches to healthcare and support. So that's what we're doing with the Spotlight series. In terms of the surveys, just an update on that. I'm going to turn it over to Alex in a little bit because he's working on our healthcare professional survey. Just as an update for our survey for deaf and hard of hearing folks, the legal team at Gallaudet has reviewed our legal contract, so they don't see any concerns with that. It's now with their finance office, and they're just reviewing their, making sure they can meet the fiscal assurances that we have in the appendix of the legal contract. And so we're just waiting to get some confirmation from them, and then the IRB institutional review board application should be completed soon, and we can move forward with the actual survey. So it's taken a little bit longer than we had thought, just with all the legalities and with the IRB application, but that's to be expected. So hopefully we'll be making some more progress on that soon. For the other survey for healthcare workers, I'll turn it over to Alex. He's been working on that. He's taking the lead on that one. And so I want to give him the opportunity to share what he's been doing with that survey. Alex?
Thanks. Yeah, we got this survey from Professor Sadler from California. This was developed in 2007, and it was a paper survey that was administered to her university and medical center in California. But we have adopted it, and we're going to make it very specific for Rhode Island. We digitized it onto SurveyMonkey, and I shared it in our Hstp group, and I believe Ernest was on the email as well. Just sort of a review or a preview of the survey. In our team meeting last night, we thought there could be an opportunity for additional questions, especially Rhode Island specific questions. And we're gonna just have to modify the survey. You know, it's still in a revision phase. The big portion of it was digitizing it onto SurveyMonkey. I'm trying to be cognizant of the length of the survey, especially with some professional advice recommending, you know, the sensitivity of people's time. So according to SurveyMonkey, it gives an estimate that it's an 8-minute survey. I feel like it's more of like a 15-minute survey, and that's without any Rhode Island additional questions. So if we're in that 15, 20-minute at most ballpark, I think that's the longest I think we could, you know, ask for people's time. So that's in the process right now. Ernest, I failed to mention in my email, but you can leave comments on that preview link that I sent out. So that's not a public final version. So any comments you have for any questions, we can see them internally as well, or you can email me or the team, so on and so forth. I guess we could expand it to this committee if you're interested in seeing the survey for review purposes. And yay or nay, or, you know, the Hstp team can, you know, decide that. But we're hoping to get this out soon, trying to capitalize on the beginning of the school year. You know, maybe people have fresh eyes and, you know, full of motivation that they would be willing to fill out this, you know, 12-minute, 17-minute survey and before the school year starts. And we're excited with the potential number of candidates that can fill this out, but we know the big effort is getting it in front of them and then re-emphasizing the importance of it, and probably following up, let's, you know, say a couple weeks after our initial launch to keep the momentum going to get feedback for this sort of stuff. Now, we could go into specifics about what we talked about as far as launch is concerned, but we want to have the goal of launching by the end of the month before the new year starts. And exactly what time frame or deadline, I suggest a shorter, you know, artificial deadlines to keep people motivated, and then we could expand that deadline to another couple weeks. You know, so you can imagine from 4 weeks is the deadline, then expand it to another 4 weeks after that. That'll bring us September, October, to the end of October. So that's the healthcare survey at this point.
And I just wanted to add to what Alex was saying in terms of the target population for this survey. And as he mentioned, we're trying to get a huge geographic spread for this, a very large sample number. So it will be disseminated to both incumbent healthcare professionals and future too. So It will be disseminated to the accountable entities to share with all of their hospital systems, physician offices. It will be sent to medical centers, clinics, urgent care. It will also be sent to all the colleges and universities with healthcare programs. So we're talking about nursing schools and physical therapy programs and other allied healthcare professionals. So we're hoping to have a very large sample size. I just hope we can get a good response from folks, but I think the more that we can put it out there, then the better chance we have of getting a large response from folks out there. So we're excited about this. And I thank Alex for all his work that he's been doing on this particular survey. It's been doing great work and it's much appreciated.
Can I ask if you have included Rhode Island NASW in that group? That's the social work group for the state of Rhode Island. We're currently without a director, but I believe there is somebody in the office. And so you would reach lots of people like me or solo providers out in the community who otherwise wouldn't be affiliated with any of these bigger groups.
We'll add that to our list, Caroline. If you have other suggestions too, please send them our way for the mental health community.
Sure.
That would be really helpful just to have that. And we're hoping perhaps to contact Rhode Island Department of Health. Carmen, maybe you can assist with this too, but there must be some kind of general registry in terms of folks that we can send this out to statewide. And perhaps that could be of assistance as well, so we can have some master list that we can disseminate this to. And if there's anybody that we're overlooking, like what Caroline just said, we can be able to identify them and have them included in this.
You could definitely, I saw the survey, but you could definitely send a request, and I would definitely forward it to the appropriate people to see if they could pass the help forward. Okay.
Thank you, Carmen.
Thanks.
Please identify it exactly there who you would like to be sent to.
Are there other networks within the deaf community that we feel like we haven't reached out to yet that we want to try to involve in this survey?
Well, this one will be for healthcare professionals. So we're talking in general. So those who work with deaf individuals, deaf and hard of hearing individuals, and those who don't, just to get an idea to assess their deaf cultural competency. So what they know about working with deaf and hard of hearing clients, should they ever encounter them. What's their cultural competency? How do they know about ASL? Do they know how to request an interpreter? Do they know about other challenges that deaf and hard of hearing individuals face when they're in the hospital? Do they know what to do in terms of how to get an individual's attention? Those kinds of things. So
it'll definitely help us identify the areas that HSTP can focus in on for education purposes for the healthcare community. So if some of those questions Christine just brought up, everyone says, I totally know, everything's great, everyone reports back fine, but this one area people don't have an idea on, great, then we don't have to tread old ground and we can reinforce the weak areas.
Have you thought about also first responders? Because when we look at the individuals in ambulances, I mean, they're medical providers and they get there first. So it might be something to consider.
Yeah, I think that's a great idea, like EMTs, paramedics.
EMTs, yes.
Thank you.
And this is something we can only go through the proper channels, right? Like through the Department of Health, and they would disseminate the survey.
Or we could disseminate it as long as we had kind of a list. I mean, certainly we can take the time to comprise a list ourselves, do the research, reach out, make sure that we're getting that geographic spread. But if there's already information that exists that already has a directory or already has a registry or a database of different healthcare facilities, of different nursing homes, of
Okay.
EMTs, paramedics, all of that. If that already exists somewhere, that's going to save us a lot of work from having to go out and try to find, you know,
Okay.
those people and those organizations. So, yeah.
Did Mike Bear do work with all the different towns and cities when he, would he also have the contact for paramedics and EMTs as well?
I think that's a great place to check. Yeah. I'm not sure how inclusive that is, though. I mean, I'm assuming that those, maybe they do have some identified on behalf of EPCAP. Maybe they've already done that work and identified all the different healthcare organizations or first responders or that exist in all the different municipalities. I can certainly check with Mike because that would be really helpful. If that doesn't exist, it would be nice to compile one for our own sake and just to have that available in the event any of us on staff needs to use it. So this is an opportunity to be able to create that list. I just, you know, want to make sure that we're not overlooking anybody either, and we're using all of our resources that are available to us on this committee and with our other state agency partners to be able to have a very comprehensive list, so we're not overlooking anyone. But yeah, I'll definitely check with Mike. I think that's a great idea, Brett, to see what he currently has too.
Right.
I'm sorry, Brett. I believe that EMTs and paramedics sometimes come through the fire departments. I don't know if Mike worked with them, but that would be a big organization in each town to reach out to. Everything from something like the ambulance corps in Foster that probably has 4 people to the city of Providence that has, I don't know how many, but many, many.
Right.
Well, I'm sure we have an emergency preparedness team on a state level that network with all 39 cities and towns, right? So it's a
Yeah,
matter of making the right connection.
Maybe.
Go ahead, Carmen.
We do at the Department of Health. Jason is responsible for it, but I just right now it's just a little bit on the busy side. So, like I said, that you can send the information forward, and I will try to forward it as many people as possible, and he would be one of them. In a good, normal, whatever normal is, day, I would have definitely walked into his office, and he would have been happy to help. I'm not saying that he's not going to, but right now we do not have the access as we did before, since again, we're just a little bit busy, busier than normal. But I will try my best to, when I receive the email, to forward it and get some direction of who would be the best individuals to send it to. But since we work with them and we have their information, I would not be able to give you their information. However, I will be able to send that in the listservs that we have. But I can't promise you anything because there's so much information going on out of the Department of Health right now that people are a little bit overwhelmed. So I'm not saying that I'm not going to do it or request it. I'm just letting you know that unfortunately the timing, as important as this is a little bit, it's just going to take a little bit of a time.
Thank you, Carmen. Appreciate that. I'm also wondering about Michelle, who is joining us from the Office of Healthy Aging, formerly Elderly Affairs. Michelle, I'm wondering if you have any, or you know of any resources for us to be able to get this survey out to healthcare professionals who serve the aging population. And I'm thinking nursing homes, rest homes, as well as other places. Would you happen to have that information?
Yeah, so also, you know, the Department of Health licenses nursing facilities and adult day centers, which would be 2 good places for you to send that information to. I can certainly provide the list, but I didn't know if that was something that Carmen would want to do, but I'm happy to do it. I can provide you the list that the Department of Health has for the names of those places, the addresses, the contact information.
Perfect. Thank you, Michelle.
And then I promise, what my last thought on this, occupational therapists, physical therapists, they must have an organization. I just don't happen to know what it is.
Okay, great. I'll look into that and find that out. Thank you. Yeah, awesome.
And I know that we still need to get a contact for the BDHH,
Mhm.
and that's another person we can ask. And what about with the hospital networks? I mean, Lifespan is obviously our biggest network in Rhode Island. And is that something more the Department of Health would reach out as well, or is that something we can talk to a liaison from Lifespan?
Carmen, did you want to go first?
Well, I could just say that if we're able to send it, I mean, different people will complete the survey by the individuals they receive it by. So the more that they see it, the most likely they are to complete it. However, then you're going to have to worry about duplication. With that said, like I said, if I could get it through the Department of Health, I'm not promising, but I just will advocate and I will try to contact the correct people. They will receive it through, I mean, every licensed person, healthcare provider, if it's put it in their listserv, they will receive it. However, with that said, they might skip Department of Health and they might get it from somewhere else. So do you have an avenue to determine if it's a duplicate or not? You know, so that way, as you send it by different people, you know, if someone completes it twice, you know that it came by the same person. So that's one of the areas to really look at.
Okay, thank you.
Hi, it's Michelle. I do have one other suggestion. A lot of our folks, you know, continue to reside in the community. Two other suggestions. One is assisted living, and the other is home care agencies or home health agencies who are providing care to individuals in the home. Is that something
Yes.
that you would be interested in?
Yes, thank you, Michelle.
Oh,
Yes.
and I lied. Hospice organizations.
Okay.
Great, thank you.
Yeah, and that's a great point that Carmen had, is that, oh, Carmen, you wanted to make a comment?
Yeah, I just wanted to make it back to Christine. So when you do the introduction of the survey, if you could actually include all the the certified individuals that you want this to go to. So that way it could go towards different departments, and then they could forward it to the listservs that they have. But like I said, however, the more people receive it, the better it might be.
Carmen, the Department of Licensure at Rideau, would they be able to, and you may have already answered this, would they be able to send it out to all of their licensed professionals that way as well? So anyone who has a license as a health professional from the Department of Health, would they be able to receive this survey?
I think they will have to review it as first, but then you see, it's like I could definitely say yes. However, we are in a different time right now.
Right.
So, and I personally do not have the access right now because everyone is working remotely or in different areas. And then the key individuals that we usually go to, they have been assigned to do different things. So I am not putting excuses. I would definitely, like I said, once you sent me the email with the specific requests of the agencies that you have mentioned, you know, the nursing home, the EMS, you know, the healthcare providers, I would definitely advocate and send it to different departments to get that done. But to like one place, like cover everything, that we would have been able to do in the past right now is just a little bit more complicated. I'm not saying it cannot be done, but I'm just saying that because of COVID, everyone is divided in so many ways. And we also have different surveys that are going out related to COVID. But this is important as everyone's work is. So I will, you know, bring it forward, and I could definitely try to get you an answer for next month's meeting. Or if I get something before then, I would definitely keep you updated.
Thanks, Carmen. Brett, I just wanted to answer your question because you had asked about lifespan. But we have the accountable entities that we work with, and my understanding is that lifespan is not one of the accountable entities, but we can get the information for lifespan from a variety of different sources. But in terms of the other accountable entities, that is most of the other hospital systems that exist throughout the state, as well as the physicians groups that are affiliated with those systems. So for example, there's Integra, there's Prospect Health, and those include, you know, Care New England. So all the hospitals under Care New England,
Okay.
you know, in Infants, Kent, and so forth, as well as the standalone federally qualified health centers. So Providence Community Health Centers and Blackstone Valley, I believe. So it includes those two. So yeah, we can also disseminate the survey through those accountable entity contacts, and they can kind of filter it down to folks.
Okay.
So yeah, so I think we have a lot of different avenues, and then we have all the colleges and universities as well throughout the state that have future healthcare professionals, all those programs. So that's a large number too. So hopefully this will have a pretty far reach.
Yeah. Well, what about, I might be thinking too much and you can stop me, but what about like Brown University and their partnership with all the medical
Yeah, absolutely. Yeah, their medical
community?
school. Yeah, absolutely.
I mean, we want it to be Rhode Island specific, right? So,
Yes.
okay. Because I'm sure they have relationships outside of Rhode Island, but we may not need that. Okay.
Right.
Okay. Right. Carmen, you raise your hand.
Yes, thank you. So I'm just thinking, did you have, or are you brainstorming right now to do a distribution plan? Because if you're able to do like a spreadsheet with a distribution plan, that way we could check mark, you know, basically from the Department of Health, okay, this, you know, you were able to get confirmation that it was sent in particular listservs. And then the other entities that people have mentioned, that way you could have like the date, the contact person, and then you could also see within your surveys how much responses you're getting based on the emails. Just a thought, so that way if DOH works or if it doesn't work or any other agency, you're seeing your progress by the individuals that you have encountered. Just room for thought.
Great idea. Great idea. Thank you, Carmen. We'll definitely do that.
All right. Well, I definitely want to make one comment, and I think Carmen had a good point, is how right now all of our hospital systems and resources are all already overwhelmed and really busy and still in preventative mode. And so it's impressive that we're even able to do a survey and to be able to get it out to our healthcare partners. And so I really appreciate your patience on it, and hopefully, and the more people we can reach a survey to, and the more people want to respond to it, because people are probably feeling more motivated to what's the word I'm looking for, to speak out. So, right. But thanks for your hard work on it, Alexander and Christine. Really appreciate your effort. All right. Any other updates on the surveys?
Nope, nothing on the surveys. That's it for the surveys.
And if you don't mind me asking, the survey you talked about in the July 9th meeting with the $5 gift card, did anything come of that since we last spoke?
Those we call video testimonials.
Oh, right, okay.
So
Okay.
it's an opportunity for community engagement. And so, you know, we wanted to offer the community the opportunity to share what they would like to see for changes in the healthcare system in Rhode Island, and they could submit a video or some kind of testimonial and share that with us. And the goal was that we were hoping to take that feedback and be able to share it during trainings that we might have with healthcare professionals later on down the road. We haven't had a lot of submissions, unfortunately, and I know it's another strange, you know, it's a strange time with COVID.
Yeah,
and
yeah,
so-
and it's summertime too. So
and
people
summer,
aren't-
and
yeah,
so many other things that are going on.
Yeah.
So we're not seeing the kind of responses that we would like to see. And so we've got that for the community. And at the same time, we have the Spotlight series, which is a little bit more academic oriented. And so
Okay.
we're trying to kind of, you know, engage the community in different ways. And so, yeah, that's our part of our community engagement. And Alex has been working on that as well. Did you want to add anything, Alex, to that?
There's still a chance to submit if you let people know. You know, there's an opportunity to make some Amazon $5.
yeah. No, yeah, definitely. Again, thanks for pushing it, and the work that definitely does not go unrecognized. So, yeah, trying times, but we appreciate it. I noticed we are over the 1 hour mark, and I don't think Simon's here. Carol, do you want a few minutes?
Fine, if you want to just keep on going.
Yeah, I mean, I don't think we
I've
have
got a
much.
meeting at 6, so I need
Okay.
to drive to it. But if we're done by
Okay.
5:30, I'm happy.
I mean, I really don't think we'll make it the full 6 o'clock. So should be there. All right. And then I think the next one was the director's community discussion with the interpreters from earlier this week. Ernest, is that something you would like to discuss?
Okay, can you pin Ernest? Ah, good. Okay.
Thank you.
Okay. First of all, thank you, Christine and Alex, for all of your hard work on the surveys. And I just think it's great. I took a look at the questions and the stuff that you're looking for. I haven't looked at it carefully, but when I have time, Monday's a holiday, I'll take a good hard look at that. First of all, the community discussion. We met with, first of all, BIPOC community, a couple of meetings. They were great discussions. We talked about different issues that people face, experiences they've had with interpreters, with hospitals, all sorts of stuff. And we hosted a community forum recently with the interpreting community. That was Monday. Oh my gosh, wow, wow, wow. There was some drama. A lot of, well, what do I say? It's hard to describe. When we set up the meeting, there was a lot of negativity, I would say, I guess I'd say, from interpreters. We had to sort of calm them down and make the meeting proceed without so much anger and lashing out. And it was really a tough meeting, I have to say, because people were fed up. They had a lot of complaints. Nothing's happening. Nothing's changed. And now, you know, I'm here and I'm trying to reach out to the community. And, you know, I agree, the interpreter services need to improve. I guess I see how serious the impact is. And on that level, it's good, but I didn't expect the meeting. I needed it to be a lot calmer and let the interpreter referral explain their role and duties and what they can and can't do, what their struggles are, what they've been dealing with over the years. And then I turned it over to Hstp to explain sorry, what am I trying to say here? Oh, to talk about the future interpreter training program and how that, what that might look like. And interpreters listened and they were appreciative, but I talked about the survey, and a lot of interpreters complained about the survey, like the percentages that I was giving people. They felt like communication had been very weak, that there was no real access to the referral service, that there was no support, that we needed to improve. And at the very end, I tried to have a discussion about, you know, what kinds of suggestions do you have for us on improvement? Because I offered maybe we could get a consultant, or maybe we could look at referral service, because the system is well recognized. I mean, the computer system that we use, maybe we could get more training in using that system. And I was looking for feedback on what we could do to really measure up. And because that system, the computer system we have, like I said, it's good, but it hasn't been super effective. And so that's our area of weakness. Then interpreters, they complain that we don't do good PR. And I say, you know, like not many of them showed up. And I did a doodle poll, and that's the date that people picked, the interpreters picked. Some people said that we didn't give enough advance notice, even though we gave 2 weeks notice. So I don't know. I guess the advertising, that was criticized, even though I thought that we did get it out there on social media. But unfortunately, I can't physically go places for safety reasons. So it was just a really tough situation. And the interpreter community wants us to have that discussion again, which we can certainly do. But Monday, it was interesting. The other thing is, and some of you contacted me, and I feel bad about this, the interpreter referral, that they got yelled at so much. I really feel badly about that. And I saw that, and I saw the anger and the frustration. And I mean, it was certainly an interesting meeting, but we will host another one, and probably we'll advertise it more in advance. We'll make sure that we've partnered more effectively with Rhode Island RID, and before we go ahead with that meeting. So, and also RIAD, we have partnered with them. We want to continue partnering with them, both the interpreting community and the deaf community. So, wow, it was not easy. It was not easy. That's all I can say. Yeah, I don't know what else to say, Brett, but we will do it again in the near future.
Thank you, Ernest. Do you think it should more of a shock at first, that after time and thinking about it, we kind of take its course and to figure out, or was it a lot of concerns and issues?
Brett, I didn't completely understand. Could you just say that again, please?
Yeah, sure. No, I was just asking Ernest, do you feel like that there are really a lot of concerns and issues that we need to start thinking about, or is it more of like, it was like projectile word vomit at first, and then like trying to understand like, okay, what's really an issue, what's really event, what's really a complaint?
Can you hang on.
All right, thank you.
Yeah. Wow, okay. Well, since I've joined the commission, at first, people complained to me about the interpreter referral service, and it was repeated and it was fairly specific, but it just got worse and worse. And then they started yelling, and then they started blaming our referral service and saying that the person's not reliable. And it's important to listen. I did get emails from people, and there were complaints, and then Hang on. I just have to clarify. So interpreters emailed me with complaints about the interpreter referral service. They said they're not doing their job. They're missing appointments. They're missing things. And that no solutions were offered, that these situations weren't documented, that, you know, their complaints never took any kind of, you know, took off. They never went anywhere. And so it's like they would complain, but then nothing ever happened. So we have to really build something. But so I never really got ideas on how to solve these problems. I mean, I certainly heard the complaints, but I never, what to do with them, you know, what are big problems? And so that's why I set this meeting up, because I wanted to identify the really big problems. And clearly the biggest problem is communication and access to the commission. So now we can dig a little bit deeper and talk about how we can solve some of these problems, because we can't just be constantly barraged with complaints and have interpreters feel like we're not doing anything. Certainly we have to document the complaints, but we're hearing the same issues over and over again. So now, you know, we do have a better idea of what the real issues are.
Okay. Caroline?
So Brett, I can't remember. Oh, sorry.
Hold on, Carol. We're just going to change the screen a little bit. Okay.
Okay.
Right. Go ahead.
I can't remember if you were present at the commission meeting where interpreters came when we were trying to develop the master agreement, and emotions ran really high at that meeting too. So I think a couple things. I think that it's become very personal towards one of the people who work at the commission. And I also think that the service and the job are impossible. And so people are very angry, but what they don't recognize is the difficulty of the job.
Okay.
And so what I wish is, of course we have to talk about it, but I think we all have to agree to a certain level of manners and civility. So rather than just yelling at each other, let's all calm down and look at what the reality is and think about what can we change now and what needs to be long range. And we don't have enough interpreters right now, but that's what the interpreter training program is about. We do maybe have some systemic issues that we can fix. So let's talk about those calmly. So that's my 2 cents.
All right. Yeah, I didn't realize. Maybe I missed a meeting. I know the meeting or two I missed in the last half year. Was it in the last half year or this past
It was,
Monday?
well, it was pre-COVID. I don't know. My memory is so since COVID and pre-COVID. So I know we were live in the.
Ernest is saying something.
I think he was saying Monday.
Oh, he's talking about the Monday meeting.
Yeah, but
Okay.
I'm talking about the past meeting. I don't remember what month it was.
'Cause I think I did miss the February meeting right before COVID hit. So
That's the one where my face became red like a tomato. You don't remember that? It was great. So much
wow.
fun.
I missed the party.
Oh, fun.
Well, yeah, definitely. If it first, we want to make sure we have a good process in place and a good system for both part for all. What's the word I'm looking for? All stakeholders involved will feel like that they're included. So that's important. Oh, I'm sorry, Christine, did you have your hand up?
Yeah, I just wanted to add that I was at the meeting on Monday as well, and I thank you, Ernest, for providing the opportunity for interpreters to be able to come and share their concerns. I do want to recognize my colleagues as well, my fellow interpreters who came out and participated in the meeting, and certainly their points are valid too. I certainly don't want to dismiss their points as being solely emotional or angry. I think they're valid, and it wasn't just interpreters, it was also victims advocates too. And I think there's a big difference between, you know, being removed from what victims advocates and interpreters see out in the community and experience out in the community on a day-to-day basis, and then folks who may be separate from that, and solely working in an office and not seeing what, when an individual goes without access, what that looks like and what that feels like and how that impacts an individual too. So I do want to validate my colleagues in terms of their concerns. And it's also a very difficult time for them as well, because many of them have lost work. Many of them, this whole service delivery model has completely changed for interpreting now. So I do want to recognize that too. And I think these concerns, are more indicative of a much larger issue, which is the culture in Rhode Island for interpreters. I think it's indicative of larger systems issues, like Caroline said. And hopefully with Hstp and hopefully the interpreter training program, hopefully more collaboration can exist, and the culture of the state can change a little bit. So it's welcoming, it's supportive. Folks don't feel either depleted because they're pulled in a million different directions, or they don't feel like they have support because they're often out there working on their own. So I just want to be mindful of that too, of my colleagues and what they're going through, and that their concerns are extremely valid, and they're going through a very emotional time too. And I look forward to the continued discussions that the Commission has with the community, including RIRID and RIAD, to try to resolve some of these issues and develop a more collaborative, a more inclusive culture throughout the community, so everyone feels as though their needs are met. So I look forward to seeing that happen, and I look forward to seeing how Hstp can be a part of that too.
I definitely appreciate that, and I have been aware that it's been an ongoing issue, and definitely something we need to focus on as a collective group and the Commission overall, and as it impacts all parts of the deaf community, from the community themselves to the interpreters, even to the Commission and the different committees we have. So I'm glad you guys brought it up. And Ernest, if you're gonna have another meeting with the interpreter, I'm more than happy to be a part of it. And like Christine said, we all need to get together and collaborate and try to be on the same page. It's one of those things where at the end of the day, we're on the same team, but we tend to forget that as we get through the muck. So, all right, okay. And I think that was it for the update on the Healthcare Committee and the Hstp projects. Before I turn it over to public comment, any more updates that 15? No? Okay. All right. And looking at our participants on the Zoom call, it does not look like we have any public comments based on nobody from the public is in the room. So we will move on from that. Number 7, schedule future meetings and monthly cadence. I will follow up again with the doodle poll and give everybody a bunch of available dates. And hopefully we'll try to do that in the next week to get a meeting going for 2 to 3 weeks from now. And if not, at the latest, a month from now. But hopefully we'll try to meet every 2-3 weeks. I know it's been a month since the last meeting, but it's been a pretty busy month, at least on my end. So I couldn't do it during it. So I apologize for that. And I'll send that out to everybody via email. And then that wrapped it up. We have the conclusion. I think that's about all we had for today's meeting. Definitely appreciate the update.
We have a question from Ernest, please.
Oh yeah, Ernest, go ahead.
Yeah. I know we're closing. I just wanted to let you know September, the month of September is extremely busy because we have, we're having a job fair. And that's on September 14th to the 18th. So it's a week-long job fair. It's daily. And we're going to have various employers who are interested in hiring deaf or hard of hearing people give presentations. I'll be sending a letter and invitations. We're also going to have different topics, such as the first day, you know, it's a Monday, meeting from 2 to 4. This is online. And the first day might concentrate on jobs in education. The second day, jobs in medicine. Third day, jobs in retail. Fourth day, jobs in, I don't know, something else, maybe restaurant work. So we're going to go different, and we're going to look at other things like service work, like UPS or the post office. So we really want to get different themes going, and altogether we'll have 5 different topics from 2 to 4 p.m. each day. So we'll have employers, we'll have interpreters, and everyone who speaks will be interpreted, and then folks who are interested in listening can then send in their resumes. So that's the 14th to the 18th of September. And then we have Deaf Awareness Month, as you probably know, the entire month of September. So we're talking about events for that month. We're going to be focusing on BIPOC, people of color, people who are Black or are Hispanic or other minority groups. We want to hear those experiences, what the history in Rhode Island for them has been like. We want to hear the good news, the bad news, the struggles, the victories. And so we're really looking for persons of color to speak up. And we want to really change the tenor and get new people. And we want to have agencies representative, like Rhode Island School for the Deaf, have many, many people of color. We want to spotlight them. We want to hear about their experience of working at a school for the deaf and expose the community to people of color who are working here. And we want to make sure that that happens during Deaf Awareness Month. So that's another plan. Then we'll have the coffee hour. It'll be virtual, of course, so bring your own coffee. Obviously, we can't do it live. And well, like I said, it's a busy month, and I'll be keeping you in the loop on that.
Okay.
And I have an addition.
Hang on one second, Carolyn. Okay, we're all good. Go ahead.
In August, we're hoping to have a couple commission meetings to interview prospective commissioners. So if memory serves, that's potentially on the 19th and the 26th. So that makes it a pretty meeting heavy month as well. That's one thing I wanted to say. The other thing as an add-on to previous, Christine, I never want to disrespect interpreters. I know how hard those jobs are, and I understand about trauma and vicarious trauma. So please don't mistake my words for anything other than a wish for us all to work together.
Agreed. Agreed.
Well, thank you for letting me know about September and Caroline with the meetings we have in August. And even if maybe we try to do 1 hour versus 2, to at least have an update and then have a much bigger meeting some point in end of September. But I definitely want to keep that cadence going. It'd be good to get updates, and if any issues come up between now and then, we can get together and talk about. And I believe me, I'm not one that wants to take time away from people's lives. And yeah, I had a problem with the 3-hour meeting, commission meeting, because that was too long. So I get where everybody's coming from. So, all right. All right. Well, on that case, I think that just about wrapped it up. And I want to give a special thank you to Carol for being a great trooper for doing an hour and a half straight. I really appreciate it. And
I'm happy to. Thank you.
So thank you very much again. And thank you to Tammy for the cut reporting. And thank you all for your time, especially in the middle of the summer. And I hope everybody's safe from the stormy weather we had and from everything else that's going on. Until then, I will keep in touch via email for next meeting update and I will share the meeting minutes before the next meeting in a more timely manner. All right. All right. Well, great seeing everybody, and have a wonderful night. Take care. Bye.
Bye. Thanks, Brett.